unable to weight bear. So most of us that come in with our foot problems are going to be, the pain is worse in standing. It's not usually worse with non-weight bearing. It's going to be worse with weight bearing. So what we want to see is what happens to the foot in a weight bearing position. So yeah, there's a bunion there. So that bunion is basically a increase in size of the first metatarsal phalangeal joint. Okay, and the noticeable thing is you usually see a lump on the inside. Sometimes you'll see even a lot more deviation of the big toe, so that it will tend to go into what we call a valgus position. So it pushes over to the side, all right? And she's starting to go there. She's not quite there. I want to take her back out. Keep working at it. Keep working at it. Get those yoga toes. Because that is what happens technically. I mean, some people, they tend to be hereditary. So some people will find that they get them easier no matter what they do. At other times it's because people have been wearing high heels for long periods of time, so they've shoved their toes forward into a narrower toe box, and that's created that deviation, which then places more stress on this joint. And sometimes it's because the little adductor muscle, or the muscle that takes the toe into this position, has started to weaken. So anybody that has bunions, I always get them to start trying to do that spread the toe thing, okay? And that can sometimes help to alleviate some of the symptoms. Other than that, we can see that she's fallen a little bit perhaps in the arch, that she's kind of coming over a little bit here, okay? And then turn up your back to us now. You can look at the Achilles and see, are they aligned up onto the heel? And that's going to give you an idea of pronation or supination as well. So on her left side, she's pretty well straight up and down on the Achilles, right? Mm-hmm. On the right side, there's just a little bit of a deviation where it looks like she's going out to the side a little bit. Okay, it's not huge. Certainly we'll see more. That because of the bunion? And that's because this foot is falling in a little bit more. She's going into more pronation. So people with pronation, when you look at them from behind, you'll be able to look at their Achilles, and you'll see that the Achilles will kind of come down and then it veers out like this as it attaches into the heel. Because, just do that correction again for me, Lorraine. You can see how that straightens it out. As soon as she lifts her arch, it straightens out the Achilles, right? So what's happening here is she's starting to lose this longitudinal arch in through the foot. Now she's not losing it as much on this side, even though she has the bunion there, all right? And so there might be a subtle leg length difference, but I'm not going to go into that just yet. Okay. All right. So let's have you turn around and face us again. I'm going to, so we kind of looked, and obviously you want to look at general alignment. You know, when I'm looking at the feet, I always like to take an idea as to what's happening at the rest of the body, so I can get a general idea. Is there any leg length difference? Just doing a quick kind of check at the iliac crest. Do they look fairly equal? Or the anterior superior iliac spine, do they look a little equal? Or you look like your right leg is just a touch longer than your left leg, probably. Which would make sense, because what we see when people have one leg longer than the other, the body will naturally try and compensate for it. So if her right leg is slightly longer, she's going to try and flatten out that arch to technically make that leg a little shorter. Okay. If, or sometimes it goes the other way around, is that this arch, or maybe both will happen, this one will fall down, this one will come up in order to try and equalize the leg lengths. So often you can use that. If one foot is pronated, check the leg lengths, and you'll be learning how to test that when Kathy does your hip and knee stuff. Okay. All right. There's 4 quick clearing tests that I like to use, and these are kind of similar to, remember at the shoulder read? Oh my goodness. Doing my yoga. We did these kind of reach behind the back with both arms. And no wonder my right shoulder is sore. Just as kind of a quick clearing test to see, okay, can they move through that full range of motion? Do they have the strength to go into those positions? So at the foot and ankle, because you don't have a lot of time in the clinic, do a quick clearing test just to give you an idea how that joint's moving, what the strength is like. So what I'm going to have her do is go up onto her toes. As she goes up onto her toes, her arch should increase a little bit. She's got awesome balance as well. We can see that. You can come back down. So she's got really good strength, really good balance as she's going up onto her toes. Both arches come into a normal position, which means that the arch itself is moving fine. She's got great range of motion, which means that the ankle joints are moving fine in that direction. Then we can test the opposite by keeping your heels down on the floor, bend your knees forward, okay, and looking to see if her arches flatten out a little bit. And looks like she's flattening out, so that means that things are moving in the foot, and she's got good range of motion there. So just a really quick clearing test, okay? Then we can take it one step further and just make sure that all the small bones, those small tarsal bones in around the ankle and the foot are moving properly. We're going to have her keep her feet planted, twist the body around to the right, and what you should see is that the foot on the opposite side starts to flatten out. The foot on the side that you're twisting to comes up a little bit into an arch. Okay, she's moving really nicely that way, and then turn, and same thing happens there. Okay, so technically, when I look at her, I go, wow, her mechanics are pretty good. Okay, so if she was complaining of something in particular, then we need to go into more depth to find out what it is. But sometimes you can pick up really quick little things with this. Right. So that's the first in kind of what we're looking at, basically. The other thing that I want to do is have her walk. So we're just going to do a very short walk because we don't have a lot of space here. Excuse me, come in front. And then just walk towards the wall and then back towards us. And what you're looking for is that she comes, you know, obviously pushes off onto her toes, lands on her heels. That's a normal walking style. Okay, and if you have an athlete that's complaining of pain when they're running, you might need to get them to run, ideally on a treadmill. Of course, you may not have that in the clinic, so it might be a little bit harder for you to assess that. Okay, but when we look at athletics, often we have to get them to do the actual activity in order to see what's going on with them. All right, one-legged stance. So I'm going to get you to stand on one foot. And really what we're looking for here is balance, okay? And she's doing really well there. Same on the other side. And oh, she was doing really well. And say we can tell that, I mean, just for her to be able to go up onto her toes like that and stay in that position, obviously she has really good balance. Okay? So yeah, it is a little bit better. I usually say don't transition too quickly from one side to the other because then sometimes you get a false pause. It's like, well, as soon as you come onto the other side, it's harder to do. So just give them a quick second in between. Okay. So we've gone into that active range of motion test, the screening test. We're going to do some non-weight-bearing types of tests for range of motion as well. So I'm going to get you to hop up onto the bed. Follow them in order. And we can have them do plantar flexion, so pointing their toes down. She's got great plantar flexion. Wow. Okay, so we're testing active range of movement here. Actively, she can pull up into dorsiflexion. Okay. Then she can go into inversion, which is turning her feet towards each other. And eversion, which is turning her feet away from each other. And she's got really good range in all of those. Obviously, remember, we're looking at range of motion. How far do they get? Is it equal from one side to the other? We're looking for any pain as she's doing that as well. Okay, any problems there? If there's a problem into the foot, then we also want to check out the toes. So can she curl her toes down? Wow, she's really good. And then she can
hang up a tree.
And can she extend the toes up? Okay. So again, looking for active range of motion throughout the foot. So that gets all of our movements that we have at the ankle. We have plantar flexion, dorsiflexion, okay, inversion, eversion, technically at the ankle, and the forefoot, the inversion, eversion play a part of that. And then we've got our toe, so if they're complaining more problems around the forefoot, you want to do toe flexion and extension. Okay. Then we can do those passively. I'm going to get you to bring your legs up this way. Just bring your foot over the edge then. Okay, so we can do plantar flexion. So, whoa, we just got lots of movement there. So we can take her down into plantar flexion. Now, if I had somebody that came in and they had sprained their ligaments on the outside of the ankle, as I do that, they're going to complain because that's going to be painful. I'm stretching those ligaments. Okay, so just do it with caution when you have a patient that, and probably actively they won't want to do the full range of motion anyway because it also will aggravate them. So all I'm doing is just giving her a little pressure at the end of the joint, asking if there's any pain. Then taking her up into dorsiflexion, so I just put my arm underneath her forefoot. I'm grabbing her heel and then just taking her into this position here. Okay, so doing passive dorsiflexion. Just feeling a little bit of spring at the end, which is normal. Obviously asking her for any pain. Taking her into inversion, which again, if she has a ligament sprain on the outside, she's not going to want you to do. It's going to be very painful. Taking her into eversion, and if she had a sprain on the inside, she's not going to want you to do that either. Okay. Then we can also do the toes. We can extend the toes, okay, and flex the toes. So if there's problems around in this area, so maybe if you had that metatarsalgia or you had a bunion, you can do them individually as well. So with a bunion, I might want to do it just on one. Does that hurt?
A little at the very end.
A little bit at the end. And how about if I do the extension? Yeah. And if there was metatarsalgia, more pain in this area, I could take them individually just to see if one joint is in worse shape than the other. Okay.
Is there a range, like obviously she has pretty flexible
Yeah.
feet, so you're
Yeah.
kind of wowing it.
Yeah.
If there isn't any pain, but you know, it was just kind of stiff, is that an issue?
It can be. So for people that get pain on the bottom of the arches, plantar fasciitis, often have really tight calves. So one of our special tests actually shows us how to test for the calf flexibility. Okay. Great. Isometric tests. So we have our movements again. So I'm going to ask you to hold your foot up. Don't let me push it down. Okay. So don't let me push your foot down. Looking for strength and pain. Not allowing any movement. Okay. Don't let me push your foot up. Again, looking for strength and pain. Okay. Don't let me turn your foot in or tight, and looking for strength and pain. And don't let me push your foot out. Again, looking for strength and pain. Okay. When you have medial arch pain, so pain in through that plantar fascia or the arch, always test great toe flexion, because the flexor hallucis longus tendon comes through the bottom of the foot and then up and behind the ankle here. So you'll want to test that just to make sure that it's okay. So pull your toe down. Don't let me pull it up. Okay. Squeeze your toes down. There we go. But you can see what happens. It's really interesting. If you come down on top here, you can see, is it going to cramp? You can see as she's trying to do that, she can't flex this toe without it coming into a valgus position. She doesn't have the strength to counterbalance it on the inside here, so she really needs to keep working at that. It's like I kind of want to hold her there. Hey, now, there you go, good. Look at that. But when I don't help her, she's just like, she veers in. She's very weak in that. So that's actually something we could work on, is just getting that, trying to maintain that position while you do a flexion. Yes. Actually, no, because if you put something between here, that's going to want her to squeeze, right? So no scars between you.
Spleen line weakness? Spleen's right.
Yeah, exactly. Spleen follows right along in there, doesn't it? So. Okay, and obviously we can do flexion and extension resisted of all the toes as well. All right, so for special tests,